Okay, so you might have lots of questions about COVID-19, popularly called coronavirus. And sometimes knowing some facts and why we're asked to respond in a certain way might help us manage our anxiety. So, what is COVID-19 and how is it different from the flu? Well, first of all, I'll be using the term vulnerable population a lot. And what I mean is the elderly, those with chronic lung disease like asthma and COPD, and those with compromised immune systems. Now, COVID-19 and influenza are both viruses that generate similar symptoms, cough, fever, aches, etc., and are rarely life-threatening. However, for some of our most vulnerable population, both COVID-19 and influenza are quite dangerous. COVID-19 seems to have a higher mortality rate than the flu, although researchers don't have enough data to be sure. Now, what I mean is, we know how many people have died from the virus so far, but we don't know how many people have been infected. And since we're missing important numbers in the equation, the mortality rate could actually be much lower, but since we don't know, caution is the best approach. Now, what makes COVID-19 so insidious is most individuals who contract the virus will show no symptoms at all. The virus can cycle through them without them knowing they've even had it. And now, well, that's good news for that individual. It also means they can also pass it along without realizing it. And that means, while you stay perfectly healthy, you could easily share the virus with someone who is vulnerable to its symptoms. Now, the vulnerable population who gets sick will need medical attention. Social distancing slows down the spread of the virus so that everyone doesn't get ill all at once. And this will keep our hospitals and healthcare providers from being overwhelmed. Slowing the virus down ensures that the healthcare system can keep up with the number of ill people and still provide the best care. Again, your sacrifices are making a huge difference. I know you've already heard that you need to do things like wash your hands frequently, cover your mouth with your sleeve when you cough or sneeze, but it's worth saying again. They're little things, but they really help. Now, there are a lot of rumors swirling around about the virus. Some are true, most are not. Keep yourself informed with facts from reputable sources and don't succumb to frightening rumors. If you hear a particularly scary tidbit of information, check it out for yourself. Snopes.com is an excellent resource. Talk to someone. Now, the most spectacular and frightening things are speculative. People imagining false conspiracy theories and worst case scenarios that will never happen. There's no need to panic. Trust me. But on the other hand, it's just as dangerous to pretend that everything's fine. Don't be in denial. This is serious. Be cautious and careful, but not fearful. Be kind. Be patient. Take this a day at a time. We as a world, a nation, and even our little theater community have gotten through tough times before, and we'll get through this.